Rahim. Today we are going to start with one of the most important topic, and that is the cholelithiasis. In the practical class, I would only very briefly discuss what is the gross morphology and the histological features and the gross morphology of the cholesterol stones. Along with that, I will discuss the chronic cholecystitis, which is very important from your university questions point of view. First of all, the cholelithiasis. The cholelithiasis means simply the formation of the stones in the gallbladder and in the associated ducts. Those may be intrahepatic or those may be extrahepatic. Some stones are purely formed in the gallbladder, while the other stones they may be formed in the gallbladder on the intra or the extrahepatic bile ducts. Among these, the stones, as you have read in the theory classes, they are divided into mainly two types. Those are the pure stones and the mixed stones. Though there is a third variety, sometimes known as the combined stones, in which the nucleus of a pure stone is there and upon which there are layers of the mixed stones. So first of all, the cholesterol stones. The pure cholesterol stones I would refer to. The cholesterol stones arise exclusively in the gallbladder. They range from 100% pure down to around 50%. Pure cholesterol gallstones are very rare, accounting for about only 10% of these stones. And the pure cholesterol stones on gross morphology, they appear as pale, yellow, round to ovoid, and have a finely granular hard external surface, which when you cut them across would show transactions revealing glistening, radiating crystalline palisades. The pigment stones, on the other hand, they are referred to as the black and the brown in general. These stones may be found, as I've told you, in the bile ducts. Those may be intra or extrahepatic bile ducts. The stones are found, may be found in the sterile gallbladder bile, and brown stones, those are found in the infected intrahepatic or extrahepatic bile ducts. I repeat once again that the black stones they are found in usually the sterile gallbladder bile. In brown stones, they are found in the infected intrahepatic or extrahepatic ducts. The black pigment stones they contains the oxidized polymers of the calcium salts of unconjugated bilirubin, small amounts of calcium carbonate, calcium phosphate, and the mucin glycoprotein. Remember this mucin glycoprotein because this is the basic constituents of almost all the stones, including the cholesterol stones and the mixed stones. Those may be the uh, black or the brown stones, and some cholesterol monohydrate crystals may be there. You can see the photograph of the black stones. The brown pigment stones contain pure calcium salts of unconjugated bilirubin, mucin glycoprotein, and a substantial cholesterol fraction and calcium salts of palmitate and stearate. I hope you remember and recall from your theory classes that the bile, which is you can say a fluid which contains a fair amount of the different solutes, and among these there are the bile salts, the cholesterol, and the other thing is the lysolecithin, lecithin, phospholecithin, etc. Those may be found in the bile. So once again I repeat, the brown pigment stones contain pure calcium salts of unconjugated bilirubin, as you can see in the slide as well. Mucin glycoprotein, I told you this is the a constituent which is found in almost all the types of the stones. The black stones they are rarely greater than 1.5 centimeter in diameter and almost invariably present in the great number, with an inverse relationship between the size and number. What does it mean? That greater is the number, lesser is the size. Lesser is the number, greater is the size. and they may crumble to touch. Their contours are usually speculated and molded. On the other hand, the brown stones, they tend to be laminated and soft and may have a soap-like or greasy consistency, and that is because of the presence of the different salts, among them the calcium carbonate and the phosphates, calcium phosphate. Approximately 50 to 75% of the black stones are radiopaque. Similarly, one thing which I forget to tell you, that the pure cholesterol stones, which we discussed in the very beginning, they are usually radiolucent. What does mean? They won't appear on the X-ray. While because of the some addition of the calcium carbonate, most of these stones they do appear on the X-ray of the gallbladder. Brown stones which contain calcium soaps are normally radiolucent. What does it mean? They won't appear on the X-ray of the abdomen. Mucin glycoprotein once again is, to emphasize the point, constitute the scaffolding and intraparticle cement for all the stones, whether pigment or the cholesterol stone. Now, one of the complications you may say or may it arise de novo is the chronic cholecystitis. This is important from the point of view that both the gross and histological features are very important, and the chronic cholecystitis is one of the conditions for which stands second for surgical operations. On top is the appendectomy, and the second comes the chronic cholecystitis. Chronic cholecystitis may be associated to repeated bouts of mild to severe acute cholecystitis, but in many instances it develops in the apparent absence of antecedent attacks. Associated with cholecystitis in more than 90% of the cases. Remember, as I've told you, that cholelithiasis is one of the things which may be associated with 90% of the cases. Now, the microorganisms which are usually found are the E. coli and the enterococci can be cultured from the bile in about one-third of the cases. And these are very important because they are with the cause of the brown stones. They may, because of the inflammation, because of the thickening or inspissation of the bile, stasis of the bile, and superadded infection by these microorganisms lead to the formation of the brown stone. Gross morphology, when you will grossly see, I will show this photograph of the gallbladder as well. The serosa is usually smooth and glistening but may be dulled by subserosal fibrosis. It may be shriveled. Shriveled means it may be shrunken when there is excessive fibrosis and the repeated bouts of the chronic inflammation. On sectioning, the wall is variably thickened, but remember one thing, that this wall is rarely, the thickness of the wall rarely exceeds beyond the 3 times of the normal thickness of the gallbladder. This is very important to differentiate it from one form of the uh, 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 carcinoma of the gallbladder, and has an opaque gray-white appearance. In the uncomplicated cases, the lumen contains fairly clear green-yellow mucoid bile. What does it mean? From the uncomplicated, when there is no infection, uh, the bile would appear green, but it may appear as greenish-yellow mucoid bile and usually stones. The mucosa itself is generally preserved. What does it mean? That there is no break in the mucosa of the gallbladder, though it may be hypertrophied. And the histological examination shows the scattered lymphocytes, plasma cells, and macrophages which are found in the mucosa and in the subserosal fibrotissue. In more advanced cases, there is marked subepithelial and subserosal fibrosis. This feature, which is also known as desmoplasia, means the deposition of the fibrous tissue where it is found in the subepithelial and subserosal fibrosis, which leads to the thickening of the wall of the gallbladder and shriveling of it. And it is accompanied by mononuclear cell infiltrate, a reactive proliferation of the mucosa, and fusion of the mucosal folds may give rise to buried crypts of epithelium within the gallbladder wall. Outpouching of the mucosal epithelium through the wall forms the Rokitansky ash of sinuses, which may be quite prominent. What is meant by the Rokitansky issue of science is, I repeat once again, that because of the continuous increase in the folds of the mucosal folds of the gallbladder, because of the reactive hyperplasia, these mucosal epithelial uh, folds may bury deep down into the mucosa, leading to the formation of the Rokitansky Aschoff sinuses. So these are the histological features which you have to remember. Once again, this is the similar the repetition of the same slide. Now, grossly, you can see here, this is gallbladder in general contracted and the wall is thickened, and it contains a single solitary cholesterol stone, which is very characteristically large one. You can see here in this micrograph. Now, the histological appearance, there are two slides. One on the left shows the typical increase in the number of the mucosal folds along with marked chronic inflammation, and the chronic inflammatory cells which are found, I repeat once again, are the lymphocytes, the plasma cells and the macrophages. On the right side you can see the outpouching of the mucosa into the deep into the wall of the gallbladder. This ends with the uh, gallbladder practical, the gallstones and the chronic cholecystitis. If you have got any queries, we shall discuss in the routine class. Thank you very much.